Christmas is the best time of the year for many children. Tom was a 10-year-old boy who, like many other children, was looking forward to Christmas. He couldn't wait to eat the countless cookies and unwrap wonderful presents. Shortly before Christmas, however, everything changed. One night, Tom woke up, unable to breathe. His parents rushed into his room and tried to help him, but he continued to struggle and his condition became worse and worse over the course of the next hours. So Tom's parents decided to drive him to the hospital. By the time they arrived, Tom's lung function was already so bad that his breath could not be detected in breathing tests. If Tom cannot breathe properly, there is a certain risk that his organs do not receive enough oxygen and get damaged. The doctors gave him a mask through which he received pure oxygen and they started to question his mother. And it quickly became clear, Tom had a severe asthma attack. Millions of people suffer from asthma worldwide and this disease can persist throughout life. Right now asthma can be treated, but there is no cure available. As you will see in some minutes, however, this might soon change. In an early study, scientists have demonstrated that we might soon be able to develop a vaccine against asthma. My name is Steinig, and today we'll talk about a potential vaccine against allergy-induced asthma. Asthma is one of the most common immune diseases and affects children and adults alike. Over 300 million people suffer from asthma worldwide and over 250,000 people die each year. There are different forms of asthma, but today we'll focus on allergy-induced asthma only. In allergy-induced asthma, dust mites, grass or tree pollen cause asthma attacks. So again, in this video we will focus on allergy-induced asthma. To see how an allergy-induced asthma vaccine could work, we first need to understand a few things about asthma. If we take a look inside our lungs, we should normally see a few but not many immune cells. If, however, we are allergic, we might not find a few but many active immune cells patrolling the lungs. The immune system behaves like there was an infection and makes the lungs swollen and inflamed. In this stage, only a tiny trigger is enough to make the immune system overreact and cause an asthma attack. In less scientific terms, we could say that the immune system behaves like a Karen here shortly before she demands to see the manager. Cultural reference here. Triggers include particles such as tree pollen, mold or dust mites. The important thing here is that the aforementioned particles are normally not harmful for us. But in the case of allergy-induced asthma, the already active immune system thinks that they impose a threat and starts to attack the particles heavily. Upon encountering a trigger, different parts of the immune system react and especially T helper 2 cells become involved. T helper 2 cells are a special type of immune cells which attract other parts of the immune system. They do that by releasing different molecules. Two of these molecules are called IL-4 and IL-13. And try to remember these names, they will become important later on. After the immune system has been activated, the airways of the lungs become narrow and mucus is released. Mucus is normally important to remove particles from the lungs, but in this case it starts to block the airways. All of that then causes the symptoms of asthma. If you've ever experienced asthma yourself or you know someone who has had an asthma attack, you know the symptoms. Asthma is characterized by coughing, wheezing, and shortness of breath. But asthma can also become more severe and cause sleep disturbances, meaning that people become tired throughout the day. This can lead to a decreased oxygen supply, meaning that organs do not receive enough oxygen and get damaged. If asthma remains untreated, the organ damages can ultimately cause the death of the patient. In the case of Tom, the boy in the beginning of this video, the doctors quickly realized that he had an asthma attack and administered corticosteroids. Corticosteroids are hormones which can inactivate parts of the hyperreactive immune system in the lungs. This, on the other hand, reduces inflammation and stops the asthma attack. Within a couple of days, Tom's lung function was back to normal. But from now on, he had to use inhalers which contain corticosteroids daily to prevent future asthma attacks. This is how allergy-induced asthma works in a nutshell. So you might now ask, why am I telling you this? A few days ago, a blueprint for the first allergy-induced asthma vaccine has been successful in preventing asthma in mice. This vaccine prototype was based on the following thought. Vaccines train our immune system to recognize certain particles. In classical vaccines, we inject inactivated viruses or bacteria so that the immune system is exposed to them and fights them off. In this process, we become immune, meaning that the immune system has learned to recognize these particles and they can also fight off the original viruses or bacteria. In the case of allergy-induced asthma, however, we do not have any harmful particles. Instead, the immune system doesn't work properly and attacks particles which are not harmful. So we need to find a way to tell the immune system to act not so weirdly anymore. And the best option is to block IL-4 and IL-13, the two molecules we've already seen in this video. Since these two molecules activate and attract other parts of the immune system, blocking them might cure the person of asthma. In the first step, scientists isolated IL-4 and IL-13 and linked them to a non-toxic version of the diphteria protein. The diphteria protein is a molecule which is instantly recognized by the immune system. Then these constructs were injected into a mouse. The immune system of the mouse recognizes the diphteria proteins and attacks them together with the linked IL-4 and IL-13 molecules. In this process, the immune system does not only learn to recognize the vaccine, but also IL-14 and IL-3, which are abundant in the lungs. In this manner, IL-4 and IL-13 should be blocked, meaning that the immune system is not triggered anymore, and that should prevent asthma attacks. In total, the mice were injected 4 times, and after 40 days they were exposed to dust mites. It was found that vaccinated mice developed fewer asthma symptoms compared to untreated mice. These effects lasted for several months, meaning that the immunity might be persistent. Since this test has been so successful, it is likely that first human trials will start soon. And I will try to keep you updated if any of these trials start. But how do we even get asthma? Asthma, like many other diseases, is complicated and caused by many different factors. Air pollution and smoking are two of the biggest risk factors of developing asthma. Children whose mothers have smoked during pregnancy have a greater chance to develop asthma, but also passive smoking during childhood is associated with the disease. Infections with viruses or bacteria shortly after birth also increase the risk of getting asthma. And then of course there is food. There is an association between obesity or fast food and asthma. Fruits and vegetables further slightly decrease the risk of getting asthma. So maybe it would be more effective to tell children to eat healthy, because otherwise their lungs will get swollen and full of mucus. Yeah, top parenting. Then of course there is genetics. If a family member of yours has asthma, then there's a certain risk that you will get asthma too. But this kind of relation is less clear, as many genes seem to have a small impact on getting asthma. But besides genetics, there is also epigenetics. Epigenetics is a scientific discipline where we investigate how genes are activated or inactivated. It is quite well documented that certain genes in the immune system of allergy patients are active. What has been quite astonishing when I learned this in university a few years ago is that allergies can also be caused by hygiene. We can observe that allergies are much more common in societies with Western hygiene. A current theory suggests that excessive hygiene can prevent the immune system from encountering parasites throughout development. This means that the immune system is not properly trained and starts to attack particles which should not be attacked. Does it mean that we shouldn't wash our hands after going to the toilet? Well, of course not. Please continue doing that. It's just an observation that parasites can be good sometimes. This vaccine might soon lead to a world where asthma patients do not have to take corticosteroids each day. Not only would asthma patients not experience the side effects of corticosteroids anymore, but numerous lives could be saved each year. But as always, what do you think? If you suffer from asthma-induced allergies, would you take such a vaccine? And also, one of you suggested this video topic, so what should I cover next? Let me know in the comment section and I can make another poll. And as always, subscribe and hit the bell button if you're new here in order to stay informed about the latest and greatest discoveries in life sciences. And with that, I'll see ya. If you're interested in the AstraZeneca vaccine blood clot controversy, click on this video here. If you want to know how close we are in creating an HIV vaccine, click on this video here.